Hello, hello. Welcome, everybody. Welcome, everybody. Let me bring my dear friend Miguel. A very important topic. Welcome. Join us. We're going to be starting this conversation with Super Dr. Miguel Stanley. Super Dr. Miguel
Hey!
Stanley.
How are you
Miguel.
doing, my brother?
Good.
Good to see
You?
you. I'm good. Everything's fine. I'm sitting here in my dental chair
I can see.
in the office. Finished a busy day of, having having headaches, solving headaches. That's
Uh-huh.
the job.
That's the
How you?
life of a dentist.
Yeah,
Busy
man.
dentist.
Where are you, my
But
brother?
yeah, people are joining. We really want to take advantage of this time, to take advantage of your precious time on a topic that I think is so important, and basically a topic that a journey that you've been going through since a long time that I think is beautiful. And I remember the first time you mentioned this term to me of revision dentistry. And I thought, man, this is brilliant. This is exactly what we need to focus on. One of the main trends in dentistry, or I hope that it will become one of the main trends in dentistry on the next decade. And when you first mentioned this to me, I was in this journey of trying to find a deeper meaning for dentistry, and in this health care environment. And I think that the reason why, I want you to talk about it is because I believe more and more dentists should be aware of what we call this silent, hidden ticking bomb that people sitting in front of you may have inside their mouth. And what are the tools and the systems and the protocols that you've been using to really differentiate you as a dentist to address this time bomb that we talk about. We know that the topic body mouth connection is becoming a hot topic, thank God. But I think that your term revision dentistry is much more down to earth, because that's exactly what we need to do. And before you even start explaining and I start asking you the questions, I want everybody to know that this topic that we are exploring today, we explored deeply on a masterclass called The Saliva Revolution. I'm going to mention this several times through the live. Anybody that wants free access to this masterclass, just comment on this live saliva. You just need to write saliva. If you write saliva, you're going to get this beautiful masterclass where I interview Miguel about how to bring saliva understanding into your business and how to do revision dentistry. So, Miguel, explain briefly to us what is revision dentistry and why this is important.
First of all, thank you so much. Um, I also think it's amazing that you, Christian Coachman, are asking me that question, because it shows what an out of the box thinker you are. You've always been always ahead of the curve, great educator. And people also have to understand, Christian, few people on the planet travel as extensively as you do and are in front and center stage week after week, year after year, around the world, not just giving your lecture, but you're listening to the industry. And so you are like a barometer of dentistry globally.
I'm a good learner.
Yeah, and of course you've got your uncle that was very heavy into wellness dentistry in Brazil, one of the first pioneers in this, so it runs in your blood as well. Look, in, I think it was 1875 in Baltimore, Maryland, Baltimore, dentistry got a divorce from medicine. And in that divorce settlement, we got the mouth to ourselves, the teeth, the gums, saliva, all of that stuff is ours and nobody else can have it. And we basically told the rest of the medical industry, this is ours and we can do whatever we want.
But
And that is,
we lost the rest of.
yeah, we lost custody. We lost custody of the rest of the body.
Yes.
And let's just think about that. I mean, that means that the mouth got siloed off from the rest of the body. Now, the mouth is part of your head. So technically, a dentist is a physician, not just of the oral cavity, but of the head. And if you are extracting a tooth, you could argue that it is an orthopedic surgery of the skull.
Yep.
Why? Because once the tooth is out, you are manipulating bone, which is part of the skeleton, which is part of the skull, and has exactly all of the same, let's say, critical interplay with your immune system that every single orthopedic surgeon in the world knows about. But orthopedic surgeons work in a hospital environment with everything super sterilized. They have teams and anesthesiologists, and they run a bunch of tests. No orthopedic surgeon in the world will do an orthopedic surgery without some blood tests, without an ECG, without making sure that the patient is in good conditions to do that orthopedic surgery. All of those surgeries are closed with primary wound closure
Hmm.
and a bandage or a ligament or a ligature. And if they are placing a artificial replacement like a hip, they will tell that patient that within 15 to 20 years that hip needs to be replaced. There's no guilt, there's no shame, and insurance companies recognize the need for revision hip surgery.
Hmm.
And that entire surgery is done in a very sterile setting.
Hmm.
So we need to start thinking that every time a dentist does a tooth extraction, at that moment, they stop being mechanics and start being
Physicians.
orthopedic surgeons.
Yep.
Yeah. Now, let's look at it this way. 50 years ago, and nobody knows the history of dentistry more than the Coachman family. You're a sixth generation dentist. So let's say your grandfather,
Yeah.
when he became a dentist, all he needed was an x-ray, a technology, and a probe to do the diagnostics. Could somebody explain to me why 50 years later, all you need is an x-ray and a
Yes.
probe to do
Uh-huh.
diagnostics?
Uh-huh. So.
And why are we just accepting that?
Yeah.
And is there something we're missing? And how come that any dentist, no matter what license they have, so as long as you're a GP,
Hmm.
you legally, no matter where you are on your learning curve, can take out every single tooth in the oral cavity and replace it with dental implants, whatever brand you want, doesn't matter. Whatever system you want, you can use whatever bone grafting material you want, whatever
Hmm.
technique you want. You can do whatever you want. You can buy the cheapest stuff on
Hmm.
earth, as long as it's registered, and no one's controlling that.
Yeah.
And my question is, if you're putting that in the bone, in the skull, if you were to tell that to an orthopedic surgeon, like a skull orthopedic surgeon, they'd be like, what the hell is that? They wouldn't understand it. So my question is, have we been let
So
alone for too long
so
without any checks and
basically,
balances in our profession?
you're just saying that some obvious stuff. There's so many things that, as we think, it becomes very obvious. We need to reset our standards as oral physicians, right? If we want to move from dentist to oral physician type of title, we need to change our standards and some fundamentals of the way we treat the oral cavity. First thing you mentioned that I think it's very interesting is the standards of sterilization and the way we value how important it is to handle the bone, right? And how the bone is connected to the rest of the body. And the bone in the skull, the bone in the mouth is in the skull. The mouth is very, very close to the brain and the heart. And these connections are proven to be
Well, we know that. Christian. Periodontal illness, gum
Yeah.
disease, periodontal illness, one of the most studied, longitudinally studied illnesses on the planet. We've known for 30 years or more its correlation to diabetes, to cardiovascular, more recently to Alzheimer's,
Mm.
and to even pancreatic cancer. As recent as September
Yeah.
2025, the Journal of American Medical
Yeah.
Association talked about porphyria monogingivalis that we all know about and pancreatic cancer. So my question is, when you're removing an infected tooth, um, why are we only giving antibiotics? Now,
Mm.
when we study the surface of those teeth, not only antibiotics, which let's say that gets rid of that, but you've got many times candida, you've got fungus, you've got other protozoas, amoebas, and virus now. We're studying more viruses that are in and around these sites, but yet we're only curetting, scraping the bone many times, only curetting and giving
Mm.
antibiotics.
Mm.
Should we be looking more? And getting back
Yeah.
to your original question, Christian, I think saliva is giving us more data than we're throwing away.
And
Saliva's been a nuisance. We have aspirators to suck it out of the
we're
mouth,
missing the opportunity.
but there's
But
data.
you're talking about two moments here. You're talking about the way we need to change the way we perform because we are in a much more serious environment, the bone, the mouth. But you're also talking about the way we need to revisit dentistry that was done in the past, right? The
That's
the
where we're
fact that
getting. Yeah,
the
yeah.
fact that the fact that we are still using tools that we used 100 years ago to see if there's a problem, yeah? And we are trained to only act if we see a problem. So if we
And
see
this
bleeding,
and let
if
me
we
just jump
see
into that.
inflammation,
And if it's visible,
yeah,
it's already too late. When you see it in the x-ray, when you see the bone loss in the x-ray, it's already too late.
mhm,
How can you see it? You should be able to see it predictively
mhm.
way before. So just
Ideal,
to go
yeah.
back to your two subjects there, and I think there's a third one, if I may. Let's step real back. There are two types of patients in this discussion. The younger patient, the younger generation of patients watching this that have very little dental work in their mouths, mostly natural dentition with a few fillings here or there, maybe one root canal, maybe one implant, but simple stuff. Okay. Or patients that are going to the dentist for the first time. That's one type of patient. Then you've got the 60-year-old patient, the 70-year-old patient that has the history of dentistry in their mouths, the entire journey of, they've got the gold inlays, they've got the first generation of dental implant, the third generation, the fifth generation, they've got gold, ceramic,
Extractions, yeah.
crown, zirconia, porcelain fused cement. They've got the entire thing in their mouths done over 40 years, well done by a good dentist. My question is, how long is that treatment supposed to last? What's happening with the interplay of multiple metals in the mouth when we know that there are metal hypersensitivities in a huge cohort of patients? What happens when the quality of the implants isn't that good, and we know there's different brands out there, and there's metals leaching into the bone? What happens when you have more than one of those implants with peri-implant inflammation that's going into the
Mhm,
bloodstream? And
mhm.
what happens when that happens in a patient with the predisposition
So,
for cancer or autoimmune? And how can we come into play and
mm.
help those patients heal
so
faster?
So
That's most important
you're
today.
saying that we still need to master the classic methods of observation that are the obvious ones. What you can see, bleeding, you can see inflammation, you can see
Okay.
recession, you can see probing, you can see depth of pockets, you can see X-rays. This is what we see, and I would say that 99.9 of action in dentistry is based on seeing these things,
It's
right?
reactive.
Yes, reacting to what we see. And it's pretty obvious that probably there's a lot of things that we don't see. And with the technology that we have today, we can see beyond the obvious. We can see the invisible. And that's what I think is the beauty of your revision dentistry. Revision dentistry is not just revisiting with the old eyes, is adding new tools.
Measuring blood, we're measuring so many things. We're measuring saliva, we're doing specific blood tests, we're talking to cardiologists,
Mhm.
neurologists, psychiatrists many times, urologists. We're even seeing interplay between fertility, people with fertility issues, people with skin rashes. I mean, all connected and studied. I mean,
Uh,
I'm not,
that's
I'm
another
not
point.
inventing,
That's
I'm not
another
inventing
point you
anything here.
mentioned.
The data
We
shows this.
When you look at a patient and you see health issues, usually as dentists, we draw a very clear line. These issues have nothing to do with me, and these issues have to do with me as a dentist, right? Draw this line. We need to change where we draw this line. And that's another thing that I learned with you and I saw happening, and you telling me about the stories of your patients, how you moved that line. You know, when we started, 20 years ago when I first heard about airway, and suddenly I realized airway is also something that a dentist can see. And I remember when I was like, oh my God, right? And we are moving, we're pushing this line between what is a health problem that has nothing to do with the dentist and what is a health problem that the dentist can actually help identify.
I think there's two reasons behind that, Christian. One is that we have a very mechanistic mindset. And I said the sentence, and I remember you tagged me once in it, which was, our profession's been hijacked by cosmetics. And so creating beautiful smiles, I mean, that's the end result. Everybody
Sure.
wants a beautiful smile, and you're the grandmaster at that. But my question is, it has to have a healthy foundation.
Mm,
And depending on the size of your microscope, that's a metaphor, those foundations might not be healthy. And there's
mm,
many times a lot of subclinical inflammation in these patients. So
mm,
my question is, when did we forget to be doctors, and when did we only become mechanics? And
mm,
when was a good bite and the mechanics of your mouth the only thing that mattered? And when did we forget about the interplay between
mm,
oral pathogens and systemic illness?
mm,
So
mm,
here
mm,
in Portugal, in 2022, a team, I've never met the guy, but there's a guy called Dr. Botelho from the University of Aigues Muniz, the university I studied at, and he published a paper with a group of colleagues showing that there were only 22 or 23 non-communicable diseases directly linked to oral inflammation. The studies go on and on since that.
yeah,
There's so many studies showing the interplay between low-grade chronic infection, subclinical inflammation, and systemic illness.
mm,
So I believe that there's a much bigger opportunity for our class here to go above and beyond giving world-class beautiful smiles,
mm,
beautiful white
mm,
teeth, but looking into old and outdated dental work and
mm.
seeing
So,
if those teeth are also
mm,
behind the systemic
so
inflammation contributing to
basically,
the
basically,
problem.
what you're saying is that there are issues going on in the mouth of most of our patients. Most of our patients have issues going on in their mouth that we cannot see with our own eyes. And if we only examine what we used to and we only diagnose what we used to and we only treat what we used to, we're going to miss the opportunity
To do more.
of of really having a much bigger impact in
And I'm
terms
going
of
to show
health.
you. I'm going to show you what we're doing right now.
Yeah.
This little machine is. It's look how big it is. It's
Miguel, just before I want you to show this machine, but before I just want to repeat to everybody, if you want to have access to a super cool master class that we recorded with Miguel for free, all you need to do is to comment saliva, just comment saliva,
saliva.
and you're gonna get this super cool master class that I recorded with Miguel that will really help you understand and implement a simple system in your practice uh, to start expanding or visualizing the invisible and helping your
Improving your
patients.
diagnostics. And Christian, also, when are we going to Miami?
So, yes, that's the other thing that I want you to help me tell everybody. We're going to have an amazing course in Miami in April. In person, 3 days. Me, Miguel, and a bunch of unbelievable guest speakers. 100% based, a focus on ethical case acceptance, incorporating these new ideas, not only to deliver better treatment, better health to our patients, but to also grow our businesses because of that.
Where can people find out more about this meeting?
Just
On your
go,
website,
yeah, just
DSD.
go. Everybody that is writing saliva will also get information in this event, in this 3 day event. So you write saliva here on the comment, you get your free masterclass, and you get information on this live in-person course in Miami. 3 days with Miguel, with me, and a bunch of top
Andrea Agnini. We got
the
some really
Agnini
good speakers there.
brothers, Carla Soto, David Alfie. I'm gonna forget people. We
Yeah,
have
the
it's
lineup
just
is
an
good.
amazing. Yeah,
I'm excited.
yeah.
I'm excited. So, Christian, let's
Show
break
me.
it down for people that are beginning here. Look, it's no longer acceptable to go into doing complex oral surgery or complex dentistry and a first appointment just with a probe, a mirror, and an x-ray. 30 years ago, CBCT entered the marketplace in dentistry and revolutionized how we can actually really see that third dimension. And
Yeah.
anybody working with CBCT understands how life-saving it is when you have that third dimension and you want to go place an implant. And oh, when you thought on 2D you had bone, boom,
Mm.
you don't have bone on the 3D. So the CBCT changed just one extra file, and all of a sudden you're seeing more, you're diagnosing better, and you're saving yourself from mistakes. Now, about 2 years ago, we got this machine in the clinic, and the cool thing about this machine, it's called Diagnostics. What does it do? It does, I think it's under 5 minutes, it does a saliva test, and it gives you a measurement of an enzyme in your saliva. This is patented technology called active MMP8. And what that does, it's a inflammatory biomarker. All right. And it exists when you have a lot of collagenemic breakdown. So if there's a lot of collagen breakdown, which could be the
Mhm.
result of stress, mostly caused by pathogens, then you'll have a high reading. If you have healthy microbiome, then you'll have a low reading. All right. Now, I'm also working a lot with
So,
athletes. We're
so
finding people
basically,
with
basically, in 5 minutes chairside, you're able to see something that you cannot see with your own eyes, right? And
impossible. And here's the cool thing, Christian. And the same machine with a little finger prick, with a little bit of blood, can measure your 25, basically your circulating vitamin D. All right.
mm,
Now, so the same machine, within 15 minutes, you can get your active MMP8 through saliva and your patient's vitamin D levels. I have been measuring my patient's vitamin D levels for a decade. Let me try and explain why that's so important. Everybody knows that vitamin D binds to calcium, and without it, your bone remodeling isn't very good. So if you're a periodontist treating your patients longitudinally for periodontal illness, and you're not understanding what's in the saliva, or even the levels of inflammation, or the patient's vitamin D levels, what are you doing? It's like, what are you doing? Why is,
let
what are
me
you doing?
repeat this. Let me repeat this. If you're doing any procedure in the mouth of the patient, if you're doing any procedure in the mouth of a patient, and you're not leveraging information from the saliva of the patient,
And the blood as well. And
the
blood.
and the blood, yes, but the saliva is where we work. It's like it makes no sense for a dentist not to leverage the saliva, not to ask the question: is there any technology out there that can allow
Yeah,
me to
and it's not
understand better
it's
what
not
is going on with the
expensive.
saliva? What the
It's not
saliva can tell me.
It's not expensive. So this machine, why I like it, this particular machine, to the best of my knowledge, is the only one that gives you an instant reading.
Chair
It
side, yeah.
doesn't tell you what kind of pathogens you have. There are multiple tests on the market today that you can then send it to a lab and it will tell you what type of bacteria you have. But let's face it, the treatment will be the same anyway, right? So what you need to understand is how much inflammation is going on in the patient's mouth. So let me just tell you this quick statistic. In November last year, I went to Dusseldorf and I presented for the very first time the results of a 2-year study where we measured over 1,008 patients over 2 years, every 3 months. The youngest patient was 18. The oldest patient was 92. It was mixed gender, so 50-50 female, male. The average age was 43. There's an apps, and everybody was measured vitamin D, and everybody measured their active MMP8
Mm,
saliva. Here's what we found, that there's an absolute correlation between low vitamin D and high levels of active MMP8, which means inflammation. The higher the level of vitamin D, the lower the active inflammation in the body, which means that you can get overall improvement in your
mm,
patient's systemic health,
mm,
oral health, periodontal health, just by
mm,
elevating vitamin D levels.
mm,
But
mm.
how do you know if you don't test?
But
How
but
do you know
the,
if you
the
don't test?
but the main point is the challenge here is how can you bring up that conversation? How can you open the conversation with the patient about something that is invisible? That's the hard thing, right? That's why,
Well,
30 years ago when we started with intraoral cameras, that was a revolution because you were not anymore saying the the restoration on your second molar has a problem, you were showing them on the screen the problem, and acceptance was much higher because of that, right? What I love about technologies like this is that they bring the invisible to the discussion. They say, look, I did the clinical examination, I did the probing, I did the x-rays, everything looked okay, but then I did this test, and this test is showing me that we should deep dive a little more because there's maybe something going on. When the patient sees the test and they understand that green is good, yellow is more or less, orange is bad, and red
Immediate.
is really bad, immediately. It's not about
Immediate.
your word. You know, it's technology. It's like a second opinion endorsing your suspicion and
So what
opening
we
the
don't,
conversation.
completely right. So here, how we do it at the White Clinic, we don't ask them if they want to do it. It's just part of the program,
Yep.
right? So it's just part of the package. The same way I don't ask them if I can take an X-ray. I mean, there's a consent form for everything, right? But if a new patient comes to the clinic, or even legacy patients doing periodontal treatment, we just do the test. You would be surprised at how many patients that I think they've got good gums and
Yeah.
their levels of inflammation is through the roof.
Yeah.
And guess what then we do? We measure the vitamin D, and the
Mm.
vitamin D is low. And then what do we do? Because we want to help patients, all we have to do is start supplementing vitamin D. And we say, look, I don't want to see you twice a year. I want to see you every 2 months
Of
until
course.
your numbers come down.
Huh?
So that patient comes more time to the practice.
Yep.
We
Yep.
gamify, you
Mhm.
gamify their oral
Yes.
hygiene,
Yep.
and they're motivated to get their levels down to 10, which is healthy in
And
this
then they
case.
understand much better, you know, when you say, look, this implant needs to be replaced, or we need to change the prosthesis, or we need to
100%.
take care of this infiltration, or, you know, the bite is maybe causing some extra stress on the system.
Christian, in diabetes, there's a measurement when you measure your blood daily. It's called HbA1c, right? It's a very specific
Mm.
uh, test that anybody that's got diabetes understands. This is that in dentistry.
Yep. Yep.
Basically, for the very first time in decades, ever since the invention of the X-ray,
Yep.
it's the first immediate chairside test. So not just one, it's two. You can
Hmm.
do your
Hmm.
vitamin D and your
Yeah.
saliva
We
and your X-ray, and you're done.
we did this test in all our students in the last course we gave, right? I did it myself. I remember when I did the test myself. I thought, yeah, I thought I was okay. I was cool, and I'm okay. I don't have restorations. I have decent gum. I'm okay. I did the test, and I knew I was kind of lazy with the flossing and hygiene. You know how we are dentists. You know, I was doing. My dad was getting crazy with me. You know, you need to come back, hygiene, hygiene, and I was postponing. I did the test, and I was okay. I was not red. I was light green, just a little bit above, and it made me act. I immediately scheduled my appointment, my hygiene. I started to floss, better. It's me that understands the topic, right? So I think that we need to change, and we talk about this, and we're going to talk about this in depth on the Miami course in April. We mentioned everybody here, unbelievable course, case acceptance mastery. But it's not about selling, it's not about marketing, it's about ethical patient onboarding. So that's why we bring both worlds together, doing the right thing, selling dentistry for the right reason, right? You said that phrase to me. And it's all about the revolution of the first appointment. And we're going to cover exactly. I always told you, since 15 years, you have one of the best first appointments that I know in dentistry, right? Besides
Thank
everything else that you do, you have one of the best first appointments, and you've been doing this for 15 years. DSD has been talking about the power of the first appointment. The magic happens on the first appointment. The revolution of modern dentistry needs to happen on the first appointment. This is one simple technology, one of the technologies that we need to incorporate on our first appointment.
And then I would argue that above and beyond this technology, lasers, dental lasers are revolutionizing the way that you can do. When you think about bacterial inflammation or infection in the mouth, a lot of dentists are not using them, completely. They're using them mostly for hard tissue, like for aesthetics and veneers and all of that. But you'd be surprised at how lasers have an active role in periodontal treatment, in socket when you're doing socket preservation techniques to decontaminate the site.
Mhm.
And I just think to bring this conversation home, Christian, we need to remember this conversation started with me saying about that divorce that happened in Baltimore in 1875 or 1890 when dentistry and medicine got divorced.
Yep.
We need to stop that conversation. We need to start thinking more like orthopedic surgeons, like
Yeah.
neurologists, like immunologists, and understand that there's an absolute interplay between the quality of our work or old legacy work from other clinicians from decades ago and the patient's immune system. And going to war just with x-ray and a probe today, I think is reckless.
Makes
We need
no
more
sense.
data. We need more information on that first appointment. And it absolutely creates something that Jim Weinstein, the head of Microsoft's healthcare program, he said when I was at Harvard in October, he said, trust and transparency is how you it's the commodity of the future of healthcare, trust and
Yep.
transparency. And by having more information on that first appointment with saliva, with the blood finger prick, simple, with CBCT, with intraoral scanning, with all of this, creating a biological and physical avatar of your patient, that creates trust and transparency. And that's why they'll stay with you and end up doing a lot more care,
Yep.
important care that they need.
Mm-hmm.
Not just beauty. Dentistry can be a whole lot more than just aesthetics.
It's an option, right? You can decide that you just want to be a cosmetic dentist,
It's fine. It's
and that's
great. I love
fine
it.
if you make it very transparent and honest about it with the patient. But I believe that most dentists, want to really enter the world of or the oral physician world, right? We want to own this space and we want to connect with the medical world and we want to be respected because of that. And above all, we want to have a bigger purpose and we want to have a more meaningful impact in patients' life, right?
You know,
And that means that we are talking about making somebody live 10 years more,
without a doubt.
making somebody live with more quality for 10, 15 years more, having an impact. How you want your patients sitting in your chair today to live the last 10 years of their life. If a patient is 50 now today, and you imagine that one day they're going to be 80, one day they're going to be 90, and what is the impact that your dentistry and you as a doctor have on the life of a patient? Not now, but when they have 90 years old, right? And we
That's so
have
important.
that power.
And I'm so grateful because, the American Academy of Cosmetic Dentistry, it's one of the biggest organizations in the world. I'll be their keynote speaker in Miami, I think a week or two before our meeting. And Amanda Say, the president, she actually invited me to talk about that to the American Academy of Cosmetic
Amazing.
Dentistry. So
Amazing.
thankfully, there's more awareness in the world around that. I'll just leave another last message here, which I think is important. So many dentists focus on investing in visible signs of wealth, nice watch, a nice car, a nice suit. I would advise you that for me, invisible signs of wealth, like using the best brand of implants, the best brand of bone grafting material, the best biologics that you put into your patient so that you're not activating an
Mm,
immune response by using some cheap product that isn't high quality.
mm,
Remember, everything you put into your patient's bone is effectively you're putting it into their skull, into activating their immune system. And why would you want to save money on buying the cheapest stuff? And I'm not even saying brands here.
mm.
There's a lot of good brands out there, but
Yep.
make sure it's high quality.
Yep.
Make sure it's
Yep.
really good. Our
Mhm,
work matters. And when you do it well, you can save a
mhm,
life. And when you do it badly, you
mhm.
can actually ruin one. I think that's super important.
100%. But let's just repeat for everybody. If you want to get access to a free masterclass about this topic, the saliva revolution, just comment below saliva. We're going to give you
Saliva.
access. We're going to give you access to this masterclass. And above all, uh, join us in Miami for this ultra special event, 3 days. Miguel Stanley, myself, and many great guest speakers at least check the program. Just check the intention. Check the intention of these 3 days. Check the
Never been done
intention of these
before,
three
what you
days.
put together, Christian. You're the
Yeah.
best in the world at that. I'm honored to be your friend. I'm honored to work with you. And you look, I think everybody here wants the same thing. When you've always wanted to elevate this profession, and I'm glad I can contribute just a little bit to this conversation.
Of course.
Saliva. See you
See
soon,
you. See
guys.
you soon. Ciao, ciao.
Bye bye.